Good afternoon. My name is Alana Feuchter, and I am the Senior Manager for National Programming with NOCC. Welcome today. This weekend, our community will be joining together for Together in Teal No Boundaries. While our traditional Together in Teal run walks are not able to take place in the interest of safety and public health, we are encouraging everyone to spend the morning of September 26th kicking off the day with an activity you choose. This might be running, walking, biking, hiking, kayaking, anything that gets you moving safely. To get you inspired, we have invited Dr. Chris Terry to talk about the importance of exercise for cancer survivors and caregivers. Dr. Terry earned his MD at Jefferson Medical College, followed by residency training at Brown University. He completed a combined residency program in internal medicine, followed by a year as chief resident. Dr. Terry is receiving his fellowship at Thomas Jefferson University in hematology and medical oncology with the Sidney Kimmel Cancer Center. He is interested in advancing the field of exercise oncology and founded the organization Teamwork, whose mission is to unite athletes against cancer. Dr. Terry also sits on the advisory board for our partner, My Victory, an at-home exercise and community platform for cancer survivors and caregivers. Thank you very much, Dr. Terry, for sharing your time and expertise with us today.
Thank you for inviting me. I'm excited to be here and excited to have this conversation.
Awesome. We will have time at the end for questions. So our viewers, I encourage you to use the chat box below to ask your questions. Keep in mind that Dr. Terry will only be answering general questions. So my question to start off for you, Dr. Terry, is you've done a lot of research in the field of exercise oncology. What have you learned about the benefits of exercising during treatment?
Yeah, so the majority of my research is actually, it's not designing clinical trials, it's not major data collection or publishing a whole lot of information. I've really had a significant interest in exercise oncology. And so I guess my research is mostly based on my medical background and studying or reading all of these studies that have been put out by my colleagues and all the literature that's been produced by them. So trying to keep up to date as much as possible with the exercise oncology literature that's out there. And then I think another part of my research is the fact that I've always loved sports. I've always appreciated being physically active, and running and participating in group activities has been important to me. And as I've started my medical career and I've come across patients and athletes across the world who have really overcome just incredible odds, I feel like part of my opinions and thoughts about exercise oncology are actually framed by a lot of those anecdotal stories that I hear from patients, which is incredible. And so when I talk about the benefits of exercise, I'll refer to both scientific evidence that I've learned during my medical training, as well as the anecdotal evidence where I've heard from patients directly or individuals directly about the benefits of exercise during their treatment or survivorship. And so what I've learned, through keeping up with the literature and hearing from patients is that there are a lot of different benefits to exercise during the cancer experience. As I alluded to, some of those can be easily measured, whereas others are not so easily measured. Physically, it can obviously certainly help with your overall strength. There's some question as to whether it can help you tolerate treatment and chemotherapy. There's questions about whether or not it can actually help with certain side effects. So certainly, quality of life side effects such as cancer-related fatigue, anxiety, depression, even some lymphedema. Those are all things that we have very strong evidence that continuing to be physically active can really benefit you during your cancer treatment. And then, of course, mentally, having the release of natural endorphins, also having a community of people who you are working alongside with or walking alongside with to achieve a common goal can really give you this sense of purpose and accomplishment that can go a long way during your treatment as well. So, I've learned also that it's safe. And so over the last there's been a change, I should say, in the field of oncology, where we used to say if you get a cancer diagnosis, you should rest your body, not do much, stay in bed, let the medicine work. And now we're changing that narrative to, you have a cancer diagnosis, but we want you to stay active. We want you to keep doing what you love. And I think that's really, really important. And it makes sense, right? If I told doctors, patients that we could give you a prescription for something that's going to reduce your risk of 7 types of cancer, that's going to reduce your mortality in certain types of cancer if you get it, or that I could give you this prescription and it would decrease certain side effects. You would be less fatigued, you'd be happier, your quality of life would be better. I think most people would write or take that prescription very happily, especially if it's free and safe. And so that's kind of the way that the medical field has started to consider physical activity, exercise, is writing it as a prescription for our patients. It should be involved in any stage of can be involved in any stage of their treatment. And we should certainly be encouraging it.
That was a great explanation. Thank you. And using it like a prescription is a great idea, a great way of explaining it. So what type of exercise might you recommend for survivors?
Yeah, that's a great question as well. So generally speaking, I feel like the best medicine is the best exercise, exercise is medicine, but the best exercise is the exercise activity that people enjoy doing. So if there's something specifically that you love, if it's walking, running, if it's dancing, bocce ball, whatever it is, something that keeps you active is the most important thing. And so I always say the best type of activity or exercise is the one that you enjoy most doing. Having said that, with different recommendations that we often give for patients, if they want a little bit more of a structured routine or a little bit more specific direction, certainly there are different types of activity that we think of. So we think of aerobic exercises, where they're generally not, they're not weight-based, and you're doing them to get your heart rate up. You're just moving a lot. And then there's resistance training, where you may bring in some elastic bands or even heavy weights, free weights. So we usually think of those 2 different types of exercise, resistance and aerobic. And really what we recommend at a minimum to really get some benefits would be about 150 minutes per week of moderate exercise. If you can bump that up to vigorous exercise for 150 minutes per week, that's awesome. So moderate exercise being like a brisk walk, vigorous exercise being a jog or a run, carrying heavy things around your house, something that's really going to get your heart rate up. And so if you're going to do vigorous exercise, I usually say you only need to do like a 30 minutes, 3 to 5 days a week. But if you are going to be doing a little bit more moderate exercise, then you certainly need to do that 30 minutes of moderate exercise for the full 5 days per week. So again, 75 to 150 minutes per week of vigorous exercise, as well as 150 to 300 minutes per week of moderate exercise if you're going to be doing that. And then trying to incorporate 2 days a week of resistance training would be ideal as well.
So the combination is important.
Yeah, absolutely.
What if you didn't exercise much before your diagnosis? Is it okay to start during treatment?
Yes, really great question, and a common question, because often when people unfortunately receive a diagnosis, they're like, okay, well, what can I do now? And so someone who may not have exercised before may all of a sudden want to. And I guess I would go back to the prior question a little bit in terms of, I would start by doing what you love, making sure that you are, to increase your chances of starting exercising and continuing to exercise, do something that you love, something that you enjoy. But really we are now finding that physical activity has a role in just about anywhere in the cancer experience. So even for patients who get a diagnosis and there may need to be a surgical procedure coming up for them, sometimes more and more programs are now introducing this idea of prehabilitation. So not rehabilitation after a procedure, but prehabilitation, meaning we're going to try and build up a little bit of strength and endurance prior to going into the procedure, so that when you come back out, you're already at a higher level, stronger than if you were to go into the procedure resting and not doing much for a prolonged period of time. So that's a relatively new area that people have been starting to study, and we've really seen some encouraging results from that so far. So certainly anytime during treatment, even if you've never done it before, I think it's absolutely okay and encouraged to start. Better late than never, for sure.
Excellent. How do you know if you are getting enough exercise? And how do you know if you are getting too much exercise, if that's possible?
Yeah, that is another great question. And it's hopefully something that we'll learn a little bit more about through some of our efforts at teamwork. As we talk to athletes or people who have been physically active for a long time, a lot of them become very in tune with their body and really just know when, okay, maybe I'm pushing it a little bit too much and I need to tone it back a little bit. Similarly, all of these high performing athletes or people who are very physically active also know that you need to take a break every once in a while, and that's okay. Your body needs to recover. There's certainly a balance in physical activity, and I think that some of those recommendations that I mentioned earlier in terms of trying to get a certain amount of time over the span of a week is a good idea, but not overdoing it. You can also look at like your steps per day. A lot of people are tracking their steps. So 7,000 to 9,000 steps per day is ideal, but you don't have to get them all at once, obviously. But listening to your body is an important thing. And, as a physician, I strongly believe that the patients know best and they know their body best. And so hopefully, as you're going through something like this, you're listening to cues from your body. You're going to have up days and you're going to have down days. I think that's another thing that as we start to encourage people to exercise during their cancer experience, it's also important to acknowledge that it's an up and down road, and there are going to be difficult times for sure and difficult days. So some days or weeks are going to be better than others. And when you're feeling good, take advantage of that and exercise. When you're not feeling good, it's okay to get some rest and let your body recover a little bit. One other thing that I guess I would say is important, and this was actually told to me by one of my patients, is that this patient really wanted to exercise all the time, and it scared his wife so much. And he loved to run, and he didn't want to lose that independence and sense of running throughout the community. So what they did was he actually ended up buying one of those Garmin devices so that one, it kept track of his heart rate and things like that, and it provided him some direction in terms of where he was going and tracking what he was doing, but also his wife knew he was safe and could keep an eye on him. So I actually think that was a very clever and great idea. It's something to keep in mind. It's probably not a great idea to exercise by yourself unless it's very, I should say it's not a great idea to aggressively exercise by yourself or really push your limits. If you're by yourself, then maybe do something that's a little bit less taxing on your body.
Makes sense. Okay, so COVID, of course, has thrown a wrench in many people's exercise plans, and many survivors have valid concerns about the safety of going into an existing gym. What other options are there for survivors with weakened immune systems who want to exercise now?
So it's interesting that electronic devices, our televisions, our phones, our computers, we've always seen those as one of the primary culprits of sedentary behavior and not being active. And the virtual and at-home fitness industry was really on the rise even prior to the pandemic. But then obviously since the pandemic, it's exploded. And so now we have this really unique ability to remain physically active during those times because we have all of these different tools or equipments that are available to us. And I think one of the cool things about it is there is still a sense of camaraderie or community from a lot of these different exercise equipments, whether it's a bike that you're using, a stationary bike that you're using at home, or a rowing machine. So there are lots of different opportunities and options to stay active at home, especially during COVID, because understandably, even if COVID wasn't going on, there are going to be times where patients with cancer are going to need to stay home rather than go into a place like a gym. So it's great that we now have these different platforms. I know at the beginning of the session you mentioned My Victory. which really has done a tremendous job of putting together a bunch of online web-based classes, and at different levels too, which I think is really, really important. They have different levels for introductory, intermediate, and so I think that they're doing a wonderful job in providing a great resource to everyone. But not everyone has the same technology or financial support as well, so sometimes it just makes us get a little creative. So if you don't have dumbbells, but maybe you can use a water bottle from your fridge or something like that to get some exercise. I would say that one of the silver linings of COVID has actually been getting to know people across the country and collaborating with people that maybe I wouldn't have before COVID. I've become very comfortable with Zoom and Facebook Live and all of these different platforms. There's a wonderful, wonderful cancer exercise trainer at the University of Texas Southwestern with the Moncrief Cancer Institute. Her name's Lisa Ross, and she's awesome. And she basically does, her passion for exercising is awesome. And she has a social media platform. Well, it's through the Moncrief Cancer Center where she does a move of the week. And so if you follow Moncrief Cancer Institute on Instagram, everybody has access to it, which is great. So I often tell some of my patients to follow them. And, you know, those clips range from anywhere from yoga poses to like a strength workout. The one week she did a dance party and got all of the nurses out with her. So it's a lot of fun, but utilizing these different things or different platforms that maybe we never did previously is an important and easy way to remain active at home, even if you're not able to go to the gym.
Thank you. I know I liked your comment about using water bottles for weights or what you have in your house, because I don't know where you are, but around here, we can't get any weights. Like that is one of those commodities that was like toilet paper in the beginning of COVID, and you just can't find them anymore. So, so being creative, like you said, is a great way to
Absolutely,
incorporate exercise.
Yeah, and sometimes even just coming up with like a little creative challenge for yourself within the home. So if you have a set of stairs or you can walk around part of your home, yeah, that's a great way to say, okay, well, I'm going to do 5 trips up and down the stairs this week, and by the end of next week, I'm going to do 7 or 8. You know, something like that is can go a long way in keeping you feeling good physically and mentally.
Yes. I'd like to now get into maybe some of the specifics about how exercise can benefit ovarian cancer patients. So for instance, the vast majority of survivors are in menopause, either due to their age at the time of diagnosis or because menopause was surgically induced due to treatment. With menopause comes bone loss. So how might exercise help?
Yeah, so as I mentioned in the beginning, in terms of the scientific evidence, a lot of the studies that have been done are largely focused on prostate cancer as well as breast cancer. So there is some overlap and some things that we can kind of correlate with other types of cancer. For bone health in particular, we know that the loss of estrogen is part of what drives the bone loss after menopause. And interestingly, physical activity and exercise actually reduces estrogen too. So it's a little bit counterintuitive, but the thought is really that, before menopause, if you're doing some weight training, more resistance training, high impact training is something that they'll refer to a lot. Those are the types of exercise that really promote bone health. So exercise where you're actually providing a stimulus to your bone to continue to get stronger and remodel. So whereas earlier I was speaking a little bit more about a lot of the aerobic exercises. Aerobic exercise is still important, but in order to really get benefit for bone strength, you're going to have to incorporate more of the resistance training or high impact training into your workouts. And most of the studies are actually done over about a span of 12 months. So it's quite a long time. It's not, a couple of weeks of impact training or weight training. You have to do it over a longer period of time. But you certainly can get benefits from it if you're doing those types of exercises. The one thing I would caution is that if there's any concern for bone involvement or metastatic disease, if you're feeling pain in your bones while you're doing these types of exercise, it's a cue to stop immediately. And I would actually recommend that you check in with your doctors or physical therapy or somebody prior to doing any high resistance training or high impact training, specifically if you have concerns about any bone disease going into it.
That makes sense for sure. We were talking about the loss of estrogen, and that's what drives the bone loss. The loss of estrogen also puts an individual at a higher risk for weight gain and heart disease. So, what might be some kinds of exercise to reduce those risks? Are they the same?
So, just as I said that, we should be doing resistance and high impact training for bone to counteract the estrogen loss and promote bone growth. Now I'm going to jump back on the other side and say aerobic training. So aerobic exercise is typically what we consider to be the best for reducing weight gain, improving cardiovascular outcomes. So the aerobic exercise really tends to minimize inflammation. It promotes good blood flow and oxygen delivery. It strengthens your heart. And as you know, it helps when people get a new diagnosis of diabetes. We encourage them to do some aerobic exercise and try and do some weight loss as well. So all of these things kind of go hand in hand. And I guess that's why when we first started this conversation, I was saying it's important to have both kind of a mix of aerobic and resistance training exercises. But specifically for those last two questions that you asked, it kind of drives that point home that, the resistance and high impact training is going to be important for your bone strength, but you can't just do away with the aerobic exercise, because that's really what's keeping your heart pumping and reducing the inflammation. And that's where you're going to see a lot of the benefits as well.
Thank you. Another question I have for you. I have two more, and then we're going to open it up to our audience. Sleep disturbances are common to many kinds of cancer, not just ovarian, as a result of either the medicines an individual is taking or perhaps from anxiety. Can you describe how exercise might help someone get a better night's rest?
Definitely. So even before entering my cancer training as an internal medicine doctor, part of good sleep hygiene, one of the things that I would typically recommend or talk to patients about is, are you exercising? Are you physically active throughout the day? Because we know that promotes good sleeping habits. So even from the outset, we know that physical activity can help that. And then specifically when you add on a cancer diagnosis, and as you said, maybe the anxiety or some of the side effects of the drugs that come along with that, one of the things that we have really strong evidence for, and I haven't said that too much about strong evidence, but one of the things we have really strong evidence for is that exercise reduces the amount or the effect of anxiety in our cancer patients. So it really reduces anxiety in cancer patients, which is fantastic, obviously. And so by reducing that anxiety with what we already know about promoting a healthier sleep regimen and sleep hygiene, I think that there's a lot of benefits that patients can have from incorporating exercise into their daily treatment to improve their sleep each night. Typically, the type of exercise that we recommend for that is actually like a brisk walk. So you don't have to go out and, run a couple miles every morning. It's a 30 to 40 minute walk, 3 to 4 days a week. So 30, 40 minute. So I actually used to say the 3-4 rule. So 30 to 40 minute walk, 3 to 4 times a week should help improve your sleep.
This is a little bit off topic, but is there a better time to exercise?
That's a great follow-up question, because especially if you're having a sleep disturbance, you don't want to do that walk. You don't want to release all those endorphins right before you're getting ready to go to bed. So that's a great point that you're bringing up. Ideally, and everybody's a little bit different, I think to set yourself up for a great day, I think it's ideal to do it in the morning. I totally understand that life happens and we all have other commitments and things that are going on. So if it's not something that you can fit into your mornings, that's not a problem. Again, you can even break it up throughout the day. If you have something that's tracking your steps on your wrist, and you see, well, I got 2,000 steps here, and then maybe a little bit later you're like, oh, I better bump up the number of steps I'm getting today. So you go for a little walk, and then it's okay to break it up throughout the day as well. That's a great question, but probably the earlier the better.
Awesome. My last question for you is the most often cited side effect, or one of the most often, I should say, side effects from the chemotherapy typically given for ovarian cancer is neuropathy. Can exercise during treatment help prevent or perhaps ease the pain from neuropathy?
Scientific evidence is minimal, mostly because we haven't been able to do a lot of studies for this. So I mentioned at the outset as well that, some things are easy to measure and some things aren't. And neuropathy, peripheral neuropathy, is mostly patient reported. And so that's why I feel like, from an anecdotal standpoint, and a lot of the patients that I've spoken with, they swear by the fact that they didn't get neuropathy because they remain physically active. A lot of patients that I've spoken to have said that. And, as we started teamwork, one of the athletes, she's one of our Olympians, and she was very, very adamant about this, that the fact that she remained physically active really prevented her from having neuropathy, which was something that she was told about and very nervous about heading into her treatment. So I certainly promote physical activity as a way to reduce or even prevent neuropathy. I think from a physiology standpoint, it's only going to promote good blood flow and oxygen delivery to your distal extremities, to your hands and your feet. So I think it makes sense from that standpoint. We talked a little bit earlier about how exercise and aerobic exercise can improve your weight, help decrease or prevent the development of diabetes. So diabetic neuropathy, by not having that additional factor in the mix, you can reduce your risk there. So I think there are a lot of things that naturally make sense as to why physical activity can either ease the pain or slow down progression or prevent peripheral neuropathy altogether. But to be, as a medical professional, somebody who is driven to be very evidence-based, I'll say that our evidence we don't have a lot of scientific evidence about it yet. I still feel very strongly that the benefits would outweigh any risks. If you are experiencing neuropathy and your hope is to overcome the neuropathy or have it go away, just be sure that prior to starting too many exercises, you aren't you're not falling, that you're being safe as well. So if your neuropathy is pretty severe from the outset, it may be worth connecting with your oncologist or your physical therapist prior to starting exercises, because certainly we want you to be safe. And again, pushing it can be, we don't want to be counterproductive in anything that we're doing. So.
Okay, awesome. I'm going to open it up for questions. So if there is some questions from our followers, please put them in the chat box. I see a lot of comments. So I see a lot of people who said exercise was beneficial to me. Liz, hello. Lynn said she likes to swim, but no pool right now, but she does walk.
That's great. Mentioning, because I don't bring up swimming much to patients, but yes, that's an awesome modality for physical activity and exercising. I'm sorry the pool's closed right now, but hopefully soon.
We're all being creative, right?
Yeah.
It looks like a lot of great comments. Lots of people, are saying that the exercise helps their mind, helps them sleep. I've got some so true comments. It looks like we must have been pretty good about asking the right questions, because we don't have a whole lot asked from the audience.
Well, that it's pretty cool that you're saying that and that you're sharing all of those comments, because really that's one of the things that I found when I was speaking with people about this topic, is that just about anybody that ends up getting physically active and doing some exercise does feel better because of it. And again, it's both for physical reasons, but also mentally, that sense of accomplishment, working with others or walking with others. A lot of people form a very close community by getting involved in different organizations that promote physical activity or hikes, or I think like there's dragon boat racing, there's all of these things, all of these really incredible charities and nonprofit organizations that do some awesome work. So
I do have a question for you
yeah.
now. Gabby asks, how do you feel about the role of cancer rehabilitation?
I think cancer rehabilitation, I think is very important. I think that probably goes along with exercise and doing things for survivorship. I guess for cancer rehabilitation, I'm assuming that you're talking about post-procedurally or post-chemotherapy. I always am a big fan of those kinds of things. Similarly with like cardiac rehabilitation and things like that, those actually are very evidence-based. So as I've mentioned that before, it's a lot of anecdotal stories. The reason why those are covered by insurance, as terrible as it sounds, is because there's more scientific evidence there to support it. So that's actually really, in the grand scheme of things, where we need to go in America is starting to show that we should be reimbursing and supporting patients who are remaining physically active. But yes, to answer your question directly, I think cancer rehabilitation is a good thing, a positive thing, and probably a step in the right direction towards ongoing exercise and physical activity after your experience with cancer.
Excellent. Thank you so much. That, I think, ends the questions that we have for you today. So thank you, Dr. Terry, for joining us and helping survivors and caregivers understand the importance of exercise. If you are interested in joining My Victory, our partner that Dr. Terry talked about, in the month of September, they are offering to give NOCC $10 of your monthly membership back for the entire year to continue supporting our work in supporting survivors. And our team will put the link in the comment section, so please look there if you'd like to register. I also want to remind everyone that we have another Ask the Experts on Tuesday, and as next week will be Hereditary Breast and Ovarian Cancer Week, we have Shelley Cummins of Myriad speaking on genetics. Finally, before I let everyone go, I encourage all of you to get out there on Saturday morning and do your favorite form of exercise before joining us at night for the national broadcast. It is not too late to register. If you haven't registered yet, I encourage you to do so at runwalk.ovarian.org, and your support will help NOCC continue our valuable programming like these Facebook Lives, Ask the Experts. Thank you again, Dr. Terry, and thank you everyone for tuning in today. Have a great day.